Disclaimer: this podcast is for educational purposes only and is not medical advice. Always consult a qualified healthcare provider before making decisions about peptides or supplements. Today we are diving into DES-1-3 IGF-1, a modified version of insulin-like growth factor 1. This peptide is created by removing the first 3 amino acids from the IGF-1 sequence. That small change makes a big difference. It reduces the peptide's ability to bind to binding proteins, which means more of it is free and active in the body. What does this mean in practical terms? DES-1-3 IGF-1 has a much stronger impact on muscle tissue growth and repair than standard IGF-1. Athletes and researchers often note its ability to stimulate local muscle growth at the injection site, which makes it stand out compared to other growth factors. Another interesting point is that it has a very short half-life. We are talking minutes, not hours. That might sound like a limitation, but in reality, it means its effects are rapid and very targeted. When administered after training, it can potentially enhance recovery and muscle development exactly where it is needed. Beyond muscle growth, research suggests DES-1-3 IGF-1 may support tissue regeneration, nerve repair, and even some aspects of anti-aging by promoting cell survival and reducing programmed cell death. However, the majority of evidence comes from animal and lab studies, and human research remains limited. Because of its potency, dosing is typically kept very low compared to other peptides, microgram rather than milligram amounts. Timing also matters. Many people who explore this peptide in experimental settings use it immediately after training to take advantage of the window of heightened muscle sensitivity. There are also important considerations and cautions. Like other growth factors, DES-1-3 IGF-1 could theoretically stimulate unwanted cell growth, including in tissues where it is not desired. That is why it is still considered experimental and not something to use casually. To recap, DES-1-3 IGF-1 is a short-lived but powerful growth factor variant with strong anabolic and regenerative potential. Its unique structure makes it more bioactive in muscle tissue, but its limited human research means much remains to be understood. Disclaimer: this podcast is for education only and does not replace medical advice. Please consult your healthcare provider before considering peptides or related therapies. Thanks for listening, keep learning, and stay curious.